here we go again, another question that was sent to us by the social media platforms. So this gentleman here is 22 years old by what he describes. He says he was born with this little bald area here on his right temple area. In hair transplantation, we know this area as a temporal peak or the temporal point, right? So he's referring to this little area here. He's not referring to the recession of the hairline that we see a little bit there. And some of his questions are very pertinent. He's asking whether it will be okay to transplant that area, if the transplant will be effective, if it will look natural as he maybe loses more hair as he gets older. And so these are all very, very good questions. And I'm glad that he is doing that and being proactive. So when I look at an area like this, you always have to think in your mind, that's why we go to school to learn about the different hair loss diseases, right? Hair loss is not just male pattern or female pattern hair loss. There are a lot of other types of hair loss that could be happening. So an exam here may tell me, if there was an inflammatory process or a traumatic process that happened in there. We do a lot of transplants into scarred areas, people that had accidents, burns, or surgery in their scalp, people that had facelifts and eyebrow lifts and have the scars where the hair doesn't grow back anymore. So transplants can grow in all of these areas. We do a lot of these procedures. So it could be a good option, but I have to make sure this is not a disease of the scalp because there are some types of hair loss that can cause this. Now, one important information that he mentioned in the question, again, I did not see him for consultation, but he says that he was born like that. And there are areas that sometimes we are born without hair. I've seen plenty of patients where they had the delivery was done by forceps, and so there's some trauma because of that. They never grow hair on the sides like this, where the forceps grabbed. In obstetrician, the obstetrician sometimes they will put during the labor, they'll put a little monitor that gets screwed into the scalp while the baby is still inside the uterus. So that is to monitor the baby's heart rate and everything like that. It's very commonly done. Sometimes that can cause a little area of hair loss. I've seen that before. Patient has a little scar where that little monitor was screwed in. So assuming this was genetically there, it never grew, yeah, it can be transplanted. It's actually in a very favorable area because his temporal point here, you can kind of see the contour. That area can recede if he loses hair. But it's such a small area that if it bothers him enough, I would be willing to transplant that. And even if he loses hair in the future, up here and the hairline recedes more, this area will still be looking natural. Maybe we need to at some point do a little bit more on the left side to match it, but this is actually a pretty safe area to transplant right now. He's asking how many grafts it will take and how much it will cost. I don't want to go into that because I have to see him, but it would be a small surgery, I would say, not very big, and it could look very natural. So I think these patients are good candidates for surgery again, but it has to be diagnosed correctly, because if this is an inflammatory process or anything like that and I try to transplant, it may fail. So I will need to see him. Obviously, I'm going by what he said in the question only. So if you're having a problem similar to this, if you have scars in your scalp from previous plastic surgery or from previous trauma or brain tumors or anything like that, talk to us. There are solutions that we can offer you that are very effective. Okay? So hope that was helpful. I'll see you next time.